Hello, I'm Trudy Haynes. Welcome to Good Day, Good Health, the program that helps you to find out more about living well and living right. And today, our topic is cancer, and we'll discuss the different forms and causes, the treatment and early detection of this terrible disease. And today, my guest is Dr. Raymond Vivacqua, Medical Director of Crozer Regional, Crozer Center, Associates, Hematology, Oncology. That's a big mouthful, but welcome anyway.
Well, thank you, thank you.
It's so good to have you here. And you're kind of an institution when it comes to treating cancers. What do you do exactly?
Well, we treat blood diseases, some of which are benign, some of which are malignant.
That comes under the hematology.
That comes under the hematology title. And oncology is the treatment of all sorts of cancers.
Like?
For instance, lung cancer, breast cancer, prostate cancer, and colon cancer. Those are the four major cancers, incidence-wise, in the country, in the world.
Now, you've been doing this for a number of years.
Yeah, more than I'd like to tell you, Trudy.
But there are probably things that you know about it that we don't, and you're going to share that with us.
I'd be happy to.
How do you know, how do you start even feeling that you might have cancer?
Well, I think an important message here is that do not delay the seeking professional advice if you have a symptom that's new to you and it's lingered on for several weeks.
Something that's not normal.
Something that's not normal. I mean, you don't want to go to the doctor when you have a headache for a day and a half or two, or if you have a pain in your tummy for a day and a half or two or three. But it's important not to let a symptom linger for more than a few weeks without seeking advice. And some of the symptoms that one can ascribe to cancer more definitively early on is things like coughing up blood, like passing blood in your stool, passing blood in your urine. Now, all of those can still have a benign cause, but those are somewhat alarming and should be looked in sooner rather than later. Sooner than several weeks, but almost immediately. But the key is to seek professional advice for symptoms that are unusual for you.
You know, we're very intimidated when we have to go to the doctor. A lot of us put it off because we're afraid. Yeah. We may not understand the terminologies, and if it's serious or not. So, and then a lot of people are uninsured, so they don't know where to go. What do you advise us to do? Where can we go? Where can we get help?
Well, I think that hospitals generally do not decline seeing a patient that may not have proper insurance or indeed can't afford it. There are various agencies there that are available nationally for individuals to support their treatment, chemotherapy, radiation therapy, etc. So I think that the more important thing is not to delay treatment, because delaying diagnosis and treatment can be a lot more costly than if you look into it early.
So if we do go, what are some of the ways that you determine? What are some of these checkups and examinations that we are privy to?
Yeah, we've become a very high-tech society, not only in medicine, but with smartphones, et cetera, et cetera. And the application of these technologies is important, but still the time-honored taking a good history from a patient to dissect out the symptoms that they are presenting to you. A good physical examination, this is extremely important. And then the physician deciding on whether the symptoms, the history, the examination warrants moving forward with some of the quote-unquote high-tech procedures. And they vary and will be applied depending on the symptoms, CAT scans, PET-CT scans, etc.
What does your hospital do? How do they treat?
Well, similar to any large facility that is dedicated to treating all sorts of illnesses, including cancer. The importance, again, is the patient-physician relationship and having a well-trained physician that goes through the history of the patient very carefully and examines them, and then decides on how best to apply the technology.
But you do some extra things. You've created some things there at the hospital.
Well, yes. The integration of the various specialties is very important, and we've done that well at Crozer. The cooperation between the generalist and the specialist, the integration of both generalists and the variety of specialists, such as the radiologists, a subset of radiologists called interventional radiologists that can help make diagnoses with a limited amount of trauma to the patient.
And I want to tell the audience right now that we're going to take you one of these days over to Crozer to show what you've done in the waiting room to make families and relatives feel comfortable, even the patients themselves, with the things that you put around them to ease that trauma.
That's very important, because there is a lot of evidence over the past number of years that stress can accelerate the advancing of the cancer, and having an emotional, more tranquil approach to this disease on the part of the patient. And some of that relates to how the doctor handles the patient with stress from the disease. But it's again, going back to the notion that it's extremely important for the patient to have, number one, an advocate once the diagnosis is made, a close friend or relative, a physician who is going to apply the necessary advances that have been made, to taking advantage of those advances both from a diagnostic and a therapeutic standpoint. And they need to have availability of the caregivers, not only their own caregivers, but their professional caregivers, so that, getting back to your question of emotional stress, it is unreasonable for patients to, for instance, to wait a week for a result from a test. That produces a tremendous amount of stress.
We're going to talk about some of those tests. We'll be right back after this message.